I'm Sonny Hallett, Chair of AMASE, the Autistic Mutual Aid Society Edinburgh. We're an autistic people's organisation, and all of our members and our committee are on the autism spectrum. The findings from our report highlight major issues with mental health provision for autistic people. Over a quarter of our respondents talked about being denied access to mental health support specifically because of their autism diagnosis. And many more talked about being misunderstood, not taken seriously or not listened to when they were trying to express their distress to practitioners. Some think that autistic people lack empathy, but non-autistic people often find it just as hard to understand us or read our emotions. Anyone who works with autistic people therefore needs to understand the importance of listening to what we're actually trying to tell them, rather than just going from what they think they see. Autism isn't a mental illness, but rates of mental ill health and suicide within the autistic population is extremely high. A recent study found that autistic people, adults without a learning disability, are up to 9 times more likely to take their own lives as someone from the general population. There is therefore an urgent need for practitioners to understand and address the issues facing autistic people in accessing mental health services. The NHS and the Scottish Government are duty-bound to provide a decent level of care for all people, regardless of disability. A diagnosis of autism, therefore, should never be a reason for an autistic person to be denied access to mental health services. Through the publication of this report, we are calling upon the authorities to improve the situation for autistic people. We recommend that they do this through ensuring that services are accessible and appropriate for us, through securing funding for services that are doing good work for improving the lives of autistic people, such as some of the existing one-stop shops, through prioritising research into autism and mental health, through providing autistic-led training for practitioners, and through creating a route for newly diagnosed autistic people to access the right kinds of mental health support. None of this should be done without the involvement of autistic people ourselves. Our message is clear: nothing about us without us.